Personal hygiene. Personal hygiene is one of the most effective ways to protect ourselves and others from illness. Hygiene doesn't just keep a person clean, hygiene helps the skin fight infection. Hygiene prevents injuries. Hygiene removes substances from the skin that might promote the growth of bacteria, and hygiene keeps a person's mouth and gum healthy. Good personal hygiene makes a person feel more comfortable and relaxed, while boosting their spirit. A person who is clean and well groomed is pleasant and to be around. Well, most older adults and persons with mental illness or mental retardation are capable of taking care of their own personal hygiene needs. Many may need help. The type of help and amount of help that is needed will be identified through a assessment. In providing assistance from the beginning, it is important to communicate to residents two important things. He or she is expected to do as much as they can to do for him or her and not be overly dependent on direct care staff person. Keep in mind, however, that residents are in a personal care home because they need personal care services, and it is the job of a personal care staff person to help provide these services. The resident's preference of personal hygiene will be respected. Maintaining personal hygiene enhances an individual's physical and emotional well-being. Yet, when it comes to a person becoming dependent on you to keep their skin, nails, hair, and mouth clean, he or she can experience a deep loss of independence and self-esteem. With this in mind, remember that self-care is always the goal. Although it may take longer for the resident to do particular task, it is best for resident to do as much as they can for him or herself. For example, someone who is paralyzed from the waist down and still has movement of their arm can brush their teeth and wash their face. This keeps the resident from becoming completely dependent and losing self-help abilities. It also helps the resident to feel capable, and it is a good exercise. The way in which you assist with personal care and hygiene ties to feelings of self-esteem and can reinforce the feeling of being valued. Does the resident prefer to take a shower or bath at night or in the morning? Many adults have been doing personal care routines for many years, and this rituals has become ingrained in daily schedules. Also, keep in mind that personal hygiene habits can vary from culture to culture. When you attempt to understand and respect cultural differences related to personal hygiene, you convey respect for the individual. This will help build a positive relationship between you and the resident, providing the option to continue with personal choices and routines will certainly help the resident feel comfortable in and in control. Bathing. Bathing can be an enjoyable and refreshing experience. A bath can be therapeutic by improving blood flow, easing discomfort, and helping the resident to relax. Always listen, consider, and try to accommodate the wants and wishes of the resident's bathing routine. The following is a list of ways in which you may assist a resident with a shower or tub bath, depending on his or her level of independence in bathing. If a resident is unable to enter a tub or shower but still wants to personally care for his or her hygiene, a good alternative is to provide a wash bowl wash bowl, or assist them in using the sink. Providing this alternative allows the person to move at their own pace while giving them the independence of caring for him or herself. Offer the resident the option of standing or sitting on a stool or chair. Hair care. An individual's appearance makes a statement about how they feel about him or herself. Encourage the resident to care for his or her hair so that they can prevent a neat and attractive appearance. Washing, drying, and styling a resident's hair can take 30 to 60 minutes. Consider scheduling a shampoo on a non-bath day to conserve the resident's energy. Hair should be combed and brushed every day to stimulate scalp circulation and distribute natural oils to the end of the hair shaft. The daily washing is not necessary, but hair should be washed on a regular basis at least once a week with a mild, non-irritating shampoo. Skin care. Skin changes with age, but the fundamental of keeping aging skin clean and healthy aren't very different from those of caring for young skin. Normal skin changes in aging include the outer layer of the skin begins to thin, making it more sensitive and easier to damage. The normal fat layer under the skin begins to disappear. This makes it easier for an elderly person to develop pressure sores as well as well colder more quickly. Oil glands do not function as well, and this makes the skin drier. The skin begins to sag and wrinkle, and it is easily brushed. Bumps and scrapes tend to tear it. Liver or age spots appear on the face, arms, and back of the head. Sweat glands decreases in activity, and this makes it harder for elderly person to lower their body temperature in hot weather. Hand care. The nail of an older adult tend to be ridged, grooved, thick, and brittle. They grow at about half the rate than those of younger adults. Weekly attention to older adults' hands keep nails attractive and in good condition. This should include wash hands under running water and clean under the nails using the pointed end of orange wood stick. Massage the nails and cuticles with lotion. Soak the nails in warm soapy water for 3 to 5 minutes. Shape nails into an oval using the fine side of a emery board, making sure not to file too close to the side of the finger. Oral hygiene. Good mouth care is valuable to health and well-being of everyone. It is especially important to the health and well-being of elderly and persons with mental illness or mental retardation. Regular brushing and flossing can prevent decay and mouth disease, improve blood flow, and enhance appetite. Additionally, the individual will look and feel better. If you assist a resident with oral hygiene, examine the mouth on a regular basis for signs of redness, swelling, or bleeding. A dentist should check any red or white spots or sores